He's a director of adult behavior services for Lotus Behavioral Services in Hartford. He's worked in public schools and private center-based autism programs and psych hospitals prior to returning to work with individuals at DDS. So, unless we have particular questions or concerns, any housekeeping things that any of the other um, clinical directors have that they wanted to mention, I think we can probably start the presentation. And again, please mics and cameras off except for the presenter. And we will have time for questions afterwards. And just as a reminder, the topic is going to be, helping individuals transition from school to our services. And Michael Soderlund is going to do that presentation for us. So without further ado, thanks, Michael.
Thank you, Dawn. I appreciate it. Let me get to my slides here. So this was sort of the product of discussions with quite a few folks within DDS, and then outside of DDS, mostly educational advocates and attorneys that I know. And in these discussions, we've recognized something that you all clearly have probably experienced as well, is that some of these transitions from school-based services to adult services to be pretty rocky. And I started to think back about my experience and spoke with our group at Lotus quite a bit about their experiences too. And what we realized is that collectively we've had quite a bit of experience with programs that send kids to adult services, both in public schools and in private center-based programs, and some of the rest like ACEs or CREC. And we also have experience working in people's homes. And it gave us an idea of how intensive some of the programming, particularly for kids with autism, can be, and how difficult that is to replicate or even transition some of those skills being taught into the environments that they're going to be in as adults. So out of those conversations, I thought, why don't we look at how we might be able to remedy some of this? This is not a long-term solution. We can do full-day workshops on this if we had the time. This is really an introduction to some long-term and short-term suggestions and ideas about easing these transitions. Excuse me. Today, you basically will identify some barriers to effective transitions for individuals with autism and intellectual disabilities and developmental disabilities. We'll discuss some implications for families, schools, and preparation for life after school. And then some thoughts on day program and residential programs, and then some short-term and long-term goals. Hold on a moment. I just realized I'm not sharing my screen. Let me do that.
I'm going to ask you about that.
Sorry about that. Let's see.
There we go. Perfect.
All right. I apologize. Okay, so this is not all about autism, but some of these ideas were born through the fact that we have a tremendous amount of young adults transitioning to DDS and adult services that do have autism. And one of the challenges there is the intensity of their programming, particularly schedules of reinforcement, and some of the teaching procedures that are used to teach students on the spectrum can create some stimulus-bound skills that don't necessarily generalize to other environments. As you can see, the rate here has increased significantly over the last 22 years, to the point that today we're looking at 1 in 36 kids are diagnosed with autism. It's a whole other discussion to have about whether that's an accurate number or not. We used to underdiagnose, maybe we overdiagnose now, but these numbers are closer to what we are experiencing as far as kids diagnosed with autism. So that kind of started looking at how this plethora of transitions that we're going to be facing in the coming years. And as students age, we're going to see more and more kids transition to adult services. that are going to be the product of some pretty intensive programming. So I looked at some outcomes. This is some outcome data on students, again, with autism that experience significant difficulty with their transitions to adulthood. They have difficult finding work, continuing school, living independently, socializing, and participating in the community. I won't go through all the numbers, but the chart on the right basically demonstrates some of those difficulties. As far as education, less than around a third of our students continue their education after a year, and very few of them go on to either 2 or 4 year colleges. Employment rates tend to be low. The first figure is 50% of the students have a paying job outside of their home, and 32% of them have a paying job within the first 2 years after leaving high school. So the employment numbers are relatively low. Also, as far as living arrangements, many of them live with their parents. So they lack the independence to live either independently or apart from their parents. The upside is that there's a high level of social activity, mostly driven by their families, but that doesn't necessarily include social interaction outside of immediate and extended family. They have a high level of services, but very low level of vocational services. So again, they do receive services mostly as far as daily care, but not vocational services. And then the rates of additional health problems tend to also be higher. And bullying and victimization rates tend to be higher. It makes sense that a lot of students that leave our public schools or private center-based programs don't really experiencing the education that bullying programs in public schools can provide. So they're more subject to that. Another study that I found talked about outcomes as well. Was a literature review looking at research on services and intervention aimed at supporting success in work, education, and independence in students 18 and older with ASD. Basically, what they found is that it's an underdeveloped field. There's not a lot of research in the area of post-secondary outcomes and services that are necessary to drive those outcomes. Hence, we have the adult services cliff that so many parents talk about. It's scary. I'm a part of quite a few transitions right now, and the change in the level of service and expertise that they experience for their children in school is very different once they transition to adult services. So that leads to frustration on the part of parents. It's very difficult for the receiving agencies and day programs. At Lotus, we work with a lot of agencies, and we're seeing this issue across the board where very complex students with very intensive programs that, in my opinion, weren't effectively fated, are creating a lot of difficulty in their transitions to day programs and group homes. And the other element that I think is very difficult is case managers don't often have the opportunity to facilitate that transition because it doesn't start early enough. For us as behaviorists, we have kids come to us that are not demonstrating skills that they may have demonstrated in IEP goals and objectives, and they're in a new environment that they've not had lengthy transitions to. And we start to experience much more problematic behavior. And for direct care staff, the lack of skill development and independence for some students creates more dependence on them. They also experience, the interactions with parents that are there trying to help facilitate that transition, and it can be awkward and frustrating for the direct care staff as well. I started to think about all that goes into educating students, and most of our providers are special ed teachers, board certified behavior analysts, occupational therapists, physical therapists, and school psychologists. They get to specialize in what they do. For us in adult services, we really don't get to do that. We need to be more generalists. We have to have a strong working knowledge of applied behavior analysis, positive behavior supports, government services, resources, mental health concerns, medication side effects, sexuality, that list goes on and on. There's a lot that goes into being a part of interdisciplinary teams for adults, and we have to have that working knowledge of a lot of areas of programming. Um, One of the things that I think is, not to knock ABA programs, but they're very structured in what they do and centered around very specific skills. And I don't think we necessarily develop all of these skills that we need in adult services when we're trained in ABA programs. So I think the biggest problem that at least I see in discussions with my colleagues, we've identified is a lack of generalization. And I think schools are focused mainly on mastery and maintenance of skills driven by IEP goals and objectives, and don't often program effectively for generality. Really, behavior intervention should be designed from the outset to operate in new environments and continue after formal treatments have ended. This is a quote from Donald Baer: "No one learns a generalized lesson unless a generalized lesson is taught." The idea here is that I think what happens in public schools, particularly out placements, they charge tuition, they get paid to show progress on goals and objectives, and it's difficult to do that long term when you're programming for generalization. The next slide will describe some ways to go about programming for generalization, but in order to show progress on IEP goals and objectives, you typically spend a lot of time teaching very specific skills or to very specific stimuli. Programming for generalization typically slows down acquisition rates, and when you're trying to demonstrate progress on IEP goals and objectives, sometimes we avoid things that slow that acquisition rate. However, that slowed acquisition rate, as far as initial acquisition of a skill, can actually help ensure that those skills generalize across environments, across exemplars, across people, and across naturally maintaining contingencies. So these are all just some ways you can program for generalization that I included here because I think this is something that our schools and our intensive autism programs really need to revisit and think in terms of long-term program development and skill acquisition and how that person or student is going to use those skills over their lifespan as an adult. So I'm not going to go through all of these in great detail, but the idea is the more we teach in multiple environments to multiple stimuli across lots of people, the more likely it is that we're programming for effective generalization, and those acquired skills, once they emerge, can be used as adults in multiple environments. So why does this matter to us? So what I found in this particular study was that 43% of the studies they looked at used more of a train and hope or train to criterion and hope technique. Basically, let's teach it here at this desk and hope this person can do it in other settings. And so only 40% of the studies actually, sorry, excuse me, that was used in 40% of those studies. So there's a large amount of them that do not use further generalization techniques other than train and hope. And also, there was 9 out of these 32 studies focused on teaching functional living skills at all. And that's one of the things that I think is a challenge for us in the DDS world, is that even if functional living skills were taught, they weren't taught in a natural environment. So often they come to us as adults, and skills that they demonstrated in school programs aren't demonstrated, say, in a group home or a day program, because they were not taught in that setting, or they weren't not taught in enough settings to actually generalize those skills. So those young adults transition to environments that we provide support in, often with pretty stimulus-bound skills that they do not generalize to other environments, such as group homes and day programs. And then what do we see? We see more problem behavior. And without getting into a long discussion about the origins of problematic behavior, most of the problem behaviors we see are due to skill deficits and communication deficits. Mainly, people don't have skills to complete tasks that they're required to as an adult, or they can't effectively communicate with people that they haven't spent a lot of time with or that are novel to them. So what do we do about this? So this was kind of a small project looking at how we might be able to make some inroads to helping develop skills and prevent problematic behavior from occurring. I looked at quite a lot of programming. I borrowed a bit from the Educational Partnership for Instructing Children, which is it's a school in New Jersey. Their whole philosophy and premise on education is that preparing for adulthood starts in preschool. Clearly, we don't have the ability to do that and may not be able to influence others to do that. But what we can do is still look at those critical skills that people need to be independent as an adult. And from the time our students transition to us as adults, we can work on them then. These are also things that if we're involved with case managers and students that are transitioning, um, have transition goals that related to residential goals and day program and community goals, we can kind of look at how can we help address their programming to help prepare them for that transition to adulthood. Um, so this idea was basically influenced by discussions with other professionals. Some transitions that I've witnessed or been a part, mainly one probably about a year ago where I was involved in a PPT, a transition PPT for a student that was 22. I had been at this school for 5 years with an extremely expensive tuition and was on a 30-second trip schedule for toileting. And the PPT went on and I kind of got stuck there. My brain went to, wow, this school costs over $100,000 a year and he's been here for 17 years. What have you been doing? And what have you not been doing? And I realized that that shouldn't happen. That person should be much more independent than that, and I knew that would create difficulties transitioning to adult services because we're not going to run 30-minute toileting trip schedules in a group home. It's very, very, very difficult to do. So that kind of spurred this idea as well of how do we remedy that? How do we reach back out to our colleagues prior to these transitions and talk to them about how they're programming for their older students and talk to them about the environments they're going to and the supports that are available there and help adjust programming to ease that transition. As Don mentioned in the beginning, I've been in a lot of places doing this type of work and have gained quite a bit of knowledge of a lot of the settings where our students come from, and then transition to group homes and day programs that we're a part of now as adults. And my thought was taking all of this experience and all of uh, the experience of my colleagues and again try to ease these transitions through help trying to influence programming and then helping our agencies that we work with receiving these students. Excuse me. I noticed in my own experience and then again in PPTs that there's often a lack of goals and objectives that drive lifelong skill development and preparation for life. I looked at life expectancies in this country is around 76 years old for men and women, and students age out of school at 22, and we have them for another 50 years. Why are we not focusing more on that next 50 years to prepare them for that next 50 years rather than focusing on some of the things that we do in school? I can't tell you how many times I've seen 20-year-olds working on letter identification and color ID and first grade math, and I always think, why are we doing that? We can do better. I also think sometimes, despite some pretty valiant efforts on the part of our schools and center-based programs, they don't actually have a good working knowledge of where their students are going to go. I started to ask people that I know, I do know quite a few people in the field that work with kids, have you ever been in a group home? The answer is almost always no. And I think that's a problem, despite the fact that some of our programs do try, and they try very, um, very much to replicate these settings. It's very difficult to replicate a setting you haven't seen. And then again, it was influenced by the programming that Epic provides their students. I'm not going to go deep into that. It's extremely comprehensive and it involves a lot of stages from preschool all the way up through adulthood. So my short-term solution, again, this is just an introduction to this. We could spend a lot of time on life skills assessments. I looked at Patrick McGreevy's Essentials for Living, which is a life skills assessment curriculum and teaching manual, and came away with 8 skills that I think are pretty essential to being an adult. One of them is making requests. At the root of a lot of our problematic behaviors, people not being able to know how to request what they want or what they need. Waiting, that's a big one. And again, often in school-based programs, students don't have to wait a lot. They have relatively frequent access to reinforcers and things that come quick. And they often have enough support staff that they can be supported through problematic behavior when they do have to wait. And that doesn't necessarily transition well to the adult world. Accepting removals, making transitions, sharing, taking turns. These are all things that are a part of adult life that some students and children don't have to do. Again, sometimes the programming is centered around meeting that student's needs immediately and doesn't involve transitioning or sharing or taking turns. Things like, dinner time in a group home, having to wait your turn to get served dinner. When that's not something you've had to do most of your life, that can be a difficult thing to do. Completing 10 consecutive brief previously acquired tasks seems like a lot, but again, part of independence as an adult is to be able to do activities of daily living and complete tasks independently and consecutively without support. Accepting no or delays to preferred activities and materials. I got some feedback on should we be saying no to individuals in adult services, and typically no. But I related that to some of our students that transitioned to us that had one-to-one staffing and very little delay to things that they want, and they haven't learned that they have to wait, or they have to wait a bit of time before they can get something that they want. And also some of our the adults transitioning to us just have poor temporal concepts, and they don't understand what you can have it in a minute means, or you can have it at 3 o'clock. They don't understand that. So just that delay in itself can actually mean no to them. And I also thought, staff make mistakes. They're going to say no sometimes, even though we prefer that they don't do that. It is going to happen. So why not prepare people for the reality of that? I didn't include a slide here, but I also went back and looked at Greg Hanley's work on interview-informed contingency analyses, and some of the treatment models following that is teaching students to accept it, delay, deny, and disappointment. And I don't see that very often in IEP goals. Just teaching students that you're going to have to wait, and sometimes you're not going to get it at all. And that's the real world. That's going to happen when they're adults. Following directions related to health and safety, again, I find is another significant skill deficits in a lot of students transitioning to adult services, where they're just not independent in maintaining their health, hygiene, and safety. And they're not really competent at completing daily living skills related to those things. I also started to think back to, the legislation that drives what we have now, which is IDEA, which was largely implemented in the late 70s, was reauthorized, I believe, in 1991. Prior to that, there wasn't a lot of compliance with that legislation. I know, when I was in high school, there was a room that students with disabilities went to, but I didn't really see them. Now they're involved in educational activities. It's an entitlement. It's their right to a free and appropriate education, just like any other student. And I think the focus on independence and daily living skills, that was a focus of educational programs more in the 70s and 80s, has fallen off a bit. It's become so much more educationally related that I think now I see students that are in their 20s that lack the independence that older individuals in group homes, say in their 50s or 60s, they have that because that was the focus of their schooling. I included here a couple other things. Those of you that are BCBAs may be more familiar with these things, the assessment of functional living skills. Again, these are things that we can look at in IEPs and transition packets to see if they have been done. If they have been done, it's valuable information. If not, we can do these things with our individuals as adults. And again, if we are able to teach skills that are often haven't been taught, we might be able to reduce some of the escape and avoidance of tasks that people don't have the skills to complete by actually teaching those skills. So the AFLS is an assessment tool. It's a tracking system and a curriculum guide. There's separate booklets for it. One focuses on basic living skills, another on home skills, community participation skills, vocational skills, and independent living skills. I know as behaviorists, we're not always involved in the whole IP, but I think administering some of these assessments might attribute to that, might help with those goals, and might help us create criterion reference ways about going about teaching, identifying and teaching these skills. The checklist of adaptive living skills, that's an older assessment. It's been around quite a while. Again, it's criterion referenced, and it measures 800 specific adaptive skills. What I like about it is, although I find it needs to be modified, each skill in the assessment includes a task analysis of the components of that skill that you can modify or even use it as it's written to teach skills to adults that are lacking some of the skills that can potentially result in problematic behavior. So why focus on functional adaptive living skills? As I mentioned, again, I'm trying to make a point there. A lot of problematic behavior we see is developed over time due to lack of skill deficits and reinforced by escape or avoidance of activities that an individual just can't do. Life skill assessments can identify and develop skills that can be taught. Again, if we have the opportunity to attribute to IP development, that can include some of the skill deficits that are at the root of problem behaviors. Also, teaching functional skills, teaching skills that replace problematic behavior are components of effective positive behavior support plans. And one of the areas of positive behavior supports is identifying skills that are functionally equivalent to problem behavior. We often find there's communication deficits that result in the development of problem behaviors that get someone what they want, get them out of what they want, they're able to gain attention, whatever the function might be. But if we can teach skills such as communication, either high tech or low tech, it could be a picture exchange, it could be sign language, it could be gestures, it could be eye movement, it can be expensive things on an iPad. Those things are functionally equivalent to problem behavior, and they have the potential to replace those problematic behaviors. Long-term solution. I won't go too in-depth in some of the skills that we identify, but what I wanted to bring up first is the section of IDEA, the reauthorization in 2004 that talks about what a transition service should be. It identifies it as a coordinated set of activities for a child with a disability that is designed to be a result-driven process focused on improving the academic and functional achievement of the child with a disability to facilitate the child's movement from school to post-school activities. Again, that's the focus here, is if we are able to work with our schools, case managers, advocates, attorneys that are involved in these transitions, we may have the opportunity to actually focus on this part of IDEA and influence the way IEPs are developed and delivered so that they are done in a way that students that transition to adulthood have the skills to independently participate in their lives. I wanted to include this. I'll go through them relatively quickly, but these are social validity questions that I think, as we try to partner with case managers that have students, we should ask these things, particularly in relation to IEP goals and objectives. There's 20 of them. I'll go through them briefly, but I think these are questions that can help us determine, are these goals and objectives effective in teaching someone skills that they need to use for the rest of their lives. And again, students are in public schools or they're entitled to school-based services until they're 22, and then they're out in adult life with us for another 50 something years, potentially. So when we look at goals and objectives, are the skills derived from a comprehensive and ongoing assessment? Again, we've talked about a couple already. We should be using criterion-based assessments to assess and identify skill deficits and use those curriculums to actually teach those skill deficits. Is the skill a prerequisite to a more complex yet important skill, such as letter ID is a prerequisite to reading? You can look at terms of letter ID, color ID in respect to being a prerequisite to traffic signs and safety signs, things that people need to know as adults. Is the skill one that can be of use across multiple environments? Without going into depth, I've been in plenty of school programs where I wonder, why are they doing that? And will that be a skill that someone can use as an adult? For example, why are middle school age students still doing letter ID? Or why are they identifying animals? Or why are they identifying colors? Those might not be things that are used to develop skills that are used as an independent adult. Can the skill be acquired by the student in a reasonable amount of time? I think that's a very important question. Often there's a lot of work that goes into developing intensive, repetitive teaching procedures intended to teach a skill. Is there a better use of that time? Again, I tend to focus on skills that folks use as adults, and I often wonder why it took 14 years to teach the alphabet. It's going to teach that long to teach skills that someone will use as an adult. So why are we not spending our time there? Also, is the skill one that will be useful in 3 to 5 years? How is that skill going to continue to develop, or will it be used at all? And if it's not something that you use over subsequent years, maybe we could be teaching something else. Is the skill one that lends itself to acceptable degree of instructional intensity? Again, without going into detail, I've seen a lot of programs where there's a lot of direct instruction, intense instruction to develop skills that might not be used for the remainder of their life after they leave school. Once acquired, is the skill one that the student will use with sufficient frequency that it will be easily maintained? Again, teaching skills that are reinforced by natural contingencies and cued by things that naturally occur in the environment is very important. Is the skill the most direct, simplest way to achieve the desired outcome? Again, when we look at skill development, if it's a goal or an objective related to safety or reading environmental signs in the community, excuse me, what is the simplest way to achieve that skill? If we're doing a lot of desktop work, why are we not looking at signs out in the environment? And how long is it going to teach to get us away from that desk and out to naturally occurring experiences with safety signs and environmental signs? Does the skill improve the student's ability to communicate? I think communication should be the crux of most programs, particularly with students that are within 5 to 6 years of aging out of school-based services. The nuances about the way they communicate with the people they know may be really complex and not easily generalized to new people and novel peers and novel environments. And I think a focus on communication skills in relation to how they use those skills outside of the walls of their school is really important. Does the school support social inclusion and peer relationships? I've been a part of a lot of programs, seen a lot of programs where there's a lot of work in, one-to-one cubbies that doesn't involve a lot of social inclusion and peer relations. When you become an adult, you share a lot of things. You share a group home, you share space in a day program, and you're going to have multiple peer relationships that you have to maintain. And there's the opportunity to be socially included in a lot of different community settings. Does the skill ultimately promote independence via adaptive behavior? Again, along with communication, I think independence is one of the most important and crucial skills to have as an adult. in my experience, I think lack of independence and significant levels of problem behavior limit opportunities as an adult. Does the skill ultimately promote independence via self-management? I've yet to see many students transition to adulthood with any focus on self-management. And I think if they don't come with self-management skills, whether it's managing emotions or behavior, that's another area where we should focus our programming as adults, and that can decrease their reliance on other people. Does this skill ultimately promote individual safety skills? Again, the way IEPs tend to work is there's a lot of emphasis on some core skills that are related to academics, but as an adult, their safety skills are extremely important, and that tends to be another underdeveloped area of individuals when they're adults. If the skill uses high tech, is it the most current tech available? I've been a part of transitions at this point where they come to us with iPads with voice output programs, and the license expired or the device is too old, and they can't make it work when they transition to a group home, and that person's lost their voice and their ability to communicate. Is the skill one that the student might find enjoyable? I looked at this question and went back to some really old data. There's an article called Indices of Happiness. And basically, it's a long article about people engage in less problematic behavior if they're doing things they like to do. It's fun and enjoyable and meaningful for them. So I think looking at skills that result in enjoyable activities is also important. Is a skill one that contributes to the student's health or a healthy lifestyle? Um, this is another area we could spend a lot of time, but I think in the effort to educate our students, we don't spend a lot of time on having a healthy lifestyle and being an active human being. And that's important to the long-term maintenance of your health as an adult. Are the skills that we're teaching culturally relevant? Um, what is culturally relevant in a school can be very different than what is culturally relevant to a group home or a community setting or a day program. Is the skill of importance to the student's family? Usually, families are a part of, well, always are a part of IEP development and IP development as adults. And I think we need to empower them to make sure that the skills they're learning are actually are important to that family. Is the skill one that has relevance to future employment? I think this is another area where we're lacking quite a bit, in that often the skills that are taught to our students aren't relevant to their future employment or don't contribute to their acquisition of employment in the future. And the last one is the skill one that has relevance to future life in the community outside of the family home. And that's often difficult to assess, but through some of the assessments that I mentioned earlier, we can identify and teach skills that are really relevant to skills used in the community and outside of their home or school. So I went back and looked at all these critical skills. I did put a lot of information here about toileting, and that's really basically to emphasize the point that some students come to us lacking independence, lacking independent toileting skills. And I thought it would be important to highlight how much of this is actually acquired in preschool and elementary school, and how much work we might have to do to actually be able to go back and teach these skills. There's a lot of data out there and research on toileting programs. There's a lot of assessments that can be used to assess someone's skills there as far as how independent they can be. Some of it is medical. I used to do a lot of toilet training, and there's plenty of medical information that is important prior to starting. There's also genetic and chromosomal disorders that result in the lack of being able to sense bladder fullness. So if our individuals don't have any of those things, it might sound weird, but we can go back and actually teach these skills that weren't taught when they were younger, and use a systemized data-based teaching program to actually try to remediate some of these skill deficits and create more independence. Excuse me. So those were the preschool ones. And by middle school, people should be able to self-advocate, be able to track their own mentees and materials, and adult supervision should be faded. The terminal goal basically is at transition, be able to select a restroom, return back to the location you came from, and adult supervision is fully faded. I haven't seen or done a lot of um, uh, toileting training in adult services. I think it's something that we should all be able to look at and consider. It does, just because someone doesn't have that independence at the time they transition doesn't mean that they can't have that. And through behavioral skills training and systematic toilet training, oftentimes adults can acquire skills that they didn't as a kid. Okay, so these are the terminal goals of toileting again. All of this is independently accessing the correct environment, blocking it to stay safe, going through a bathroom routine, and returning back to your location independently. Dressing. These are just terminal skills for dressing that I often see as a skill deficit too. Closing a door for privacy, selecting appropriate clothes, because we're in New England, seasonally appropriate clothes, putting them on in the correct order, and checking for appearance before leaving your room. This is another area that we can use some of the systematic teaching processes, procedures that we have available to us to work with adults to create independence here as well. Independent eating is another skill deficit that we looked at as essential to success as an adult, and lack of reliance on other people as an adult. It's basically the ability to use appropriate utensils to eat a variety of foods neatly and at a culturally accepted pace in the absence of reminders and adult supervision. Again, going back to those skills assessments I mentioned, independent eating is always one of them. And again, the more we can teach, even as adults, independent eating skills, the less of task avoidant behavior we might get, and the more independence we can create. Bathing and self-care is another critical skill area that I think is often underdeveloped when adults come to us in adult services. And again, it's basically demonstrating the ability to independently bathe, shower, complete relevant self-care and hygiene skills such as toothbrushing, grooming, brushing your hair, drying off with a towel. A lot of those things are either not taught or done by other people prior to becoming an adult, and can linger as a skill deficit as an adult. Household participation. When you transition to a group home, you have to participate with other people and things. And again, often these skills are either not taught or they're so frequently done for them that those skills don't develop. Some of the expectations of being an adult in a residential setting is that you can do household chores. And excuse me, um, often that's a pretty underdeveloped skill. It, it's hard to target those in a school-based setting because it's not usually the emphasis of a school program. But these are pretty essential skills to an independent adult living, and often they're not initiated at all, or too late, and those skills don't develop. Sometimes, as I mentioned, it might have taken someone 14 years to identify letters in an alphabet, and then we start teaching household skills or independent living skills in the last 2 years of an IEP, and there's just not enough time for that person to acquire those skills. One that I think is a pretty and often neglected area of development is the ability to learn in a group, or just be in a group or participate in a group. That's often not what we see in school-based settings, particularly for students with autism. They tend to be involved in one-to-one instructional arrangements, and don't always um, fade back out into dyads or triads, or anything that mimics the small and large group settings that we designate in adult services. So That can be a really difficult part of the transitions to the services that they receive as an adult, is that they just haven't had a lot of time in groups or never really learned to be in a group or learn in a group or participate in a group. And as an adult, they participate in groups all the time, whether it's in their residence or on a trip out to the community or in a day program. Self-management is also an area that I find to be underdeveloped in a lot of students transitioning to adult services. It's basically the ability to regulate their own behavior using thin schedules of reinforcement, reduce supports from external sources in a variety of settings and situations at home, school, work, and in the community. And again, I think the schedules of reinforcement that maintain behavior or prevent engagement in problematic behavior in school settings can also often be a barrier to um, self-management as an adult. Those schedules of reinforcement tend to thin out in the adult world. There's not as much reinforcement for not engaging in problematic behavior, and the ability to self-manage that independently of other people is a really important skill to have as an adult. Problem solving. Again, another area where I think there's not a lot of emphasis on training when our adults or our students is how do we identify things in the environment that um, cue problematic behavior and how to solve those problems. We do quite a bit in our behavior support plans around active listening, validation, and problem solving. And that's not an approach that I see all that often prior to coming to adult services. And I think the time spent teaching someone how to identify things in their environment that cause distress and take steps to solve those problems or eliminate those things that cause distress is a really valuable skill as an adult. And then maintaining physical safety. This is another area, again, I think when students comes to us as an adult, we should spend time on teaching people to identify and avoid non-human danger in the environment and discriminate between safe and unsafe people, making sure people know hot and cold, know about, cars can hurt you if you're in the road, those sorts of things. And I think one of the things that um, we've probably all seen is lack of being able to maintain your own safety can result in one-to-one staffing that I think could be avoided. And again, there's not always a lot of emphasis on teaching these skills when our adult individuals are students, and that can result in an over-reliance on other adults in the environment with a staffing ratio that could have been avoided. In relation to safety skills are one of those areas where you you really don't get a lot of opportunity to make mistakes. We don't want to learn, running into the road is dangerous by experience all that often, um, which is why I wanted to bring up behavioral skill training within our literature. It's a well-supported way of teaching skills by delivering instructions to the learner, modeling the correct responses, rehearsing the correct responses in both pretend and more naturalistic environments, and then providing feedback. This is one way that, regardless of the skill level or their communication ability of an adult individual, we can teach these skills. Um, so one of the other things that I wanted to mention is that there's a lot here, and I think we're still basically dealing with the fact that we'll end up relying on staff to teach these things. And again, I think it's worth the time because we may be able to eliminate quite a bit of problematic behavior if we enhance people's skills and their ability to communicate. We're actually working with the University of Kansas right now on a project. It's a train the trainer project where we're working with an agency to develop baseline assessments of their employee behavior, retention rates, those sorts of things. And the idea is that we are going to be a part of them developing trainer positions where they use behavior skills training to teach trainers to teach other people how to do elements of their job. And it's one of the inroads that we, selected as how do we help develop the skills of direct care staff and hopefully have some impact on retention rates. My thought is that if you have a systematic way of delivering training and performance feedback, people can be more successful in their jobs and less likely to leave their jobs. And then we've become part of an agency's onboarding training. They gave us, I think, 3 or 4 hours in their training to teach positive behavior supports and teach them everything that goes into behavior support plans and teach them the background of all of the things that we're talking about now and behavior support, so that we laid that foundation in a couple different ways for staff to be more successful teaching some of the things that we're talking about here in the running behavior support plans. All right. Communication I left here as I think the last one. Again, can be at the root of a lot of problematic behavior. Really not being able to tell people what you want, what you need, what you don't want, and what you don't need can be very frustrating. That can result in engagement in other behaviors very early on that persist into adulthood. And I think one of the things that falls by the wayside, unfortunately, when they come to us is that we don't continue on with low-tech things like picture exchange systems or even rudimentary sign language or anything assisted or augmented communication, such as like voice output on an iPad or communication devices, other communication devices that might have been used in school. And I think that's one of the areas where we see increases in problematic behaviors when that communication support doesn't come to adult services with us, or things were written in a way that the communication support is complex and intensive, and it's not easily delivered or maintained by direct care staff. My closing thoughts basically are this is the beginning of an approach that we're trying to take as an agency. We have a lot of relationships with public schools, private schools, case managers, transition case managers. And I think if we leverage those, we can become an important resource in IEP development, focus on transitions to life as an adult. And again, we don't always have that opportunity. I have one right now that I'm very fortunate to be a part of. That school district agreed to outplace a student residentially and in a day program, and we've got much more time to focus on facilitating that transition at age 22 to adult services. And it's actually a pretty exciting one because it's a well-coordinated effort between myself and agency and the school district, and I actually get to do all the things that we've been talking about today. Excuse me. I know of other services that provide transition services to families. Most of that is around planning, the legal planning, and the role that schools and IEPs play in that transition. But I think in sticking with the definition of a transition in an IEP, we should be developing programming that's designed as a result-oriented process focused on improving the academic and functional achievement of the child with a disability to facilitate the child's movement from school to post-secondary activities. So again, if we are able to be engaged earlier on, or use some of what we talked about today, if we aren't engaged early on in that transition, we can use all that to try to develop additional skills, better communication skills, and hopefully reduce problematic behavior that way. I think if we are able to do some of what we are talking about today, that can reduce the pressure on agencies, staff, and ease some of the frustration on the part of families. I've known a lot of families at this point that have had a difficult time watching their children transition to becoming adults. And again, I think if we can work with them and our agencies and schools, we may be able to implement transitions that are far less distressful for all that are involved, particularly our families. So that's it. Thank you very much. I guess we can open up to questions, or if there aren't any, I guess Dawn, you can take over and do the rest of the time.
Thank you, Michael.